Hello to the National Center on Sexual Behavior of Youth, YPSB Journal Club. It's also the OJJDP Journal Club, and we are very excited to have you all today. It is an amazing feat to get someone who has done PSB work in school systems and to have that person share their experiences and expertise with us today is amazing. My name is Jimmy Whittyfield Jr. I'm the training director of the National Center. And here in Oklahoma City, I'm joined by many members of our team in Oklahoma, Paul Schaller, Julie Jones, Carrie Schwab, and Erin Taylor. Erin is going to be the host for today's event, and I will switch to her in just a moment. I see YOS is on, and she is the mysterious call 10. So I'm going to take over in just a moment. I want to do some quick housekeeping. Please remember that we mute your line through WebEx to reduce background noise during the presentation. Be able to mute and unmute yourself through the WebEx application by finding your name or calling user number in the participant box and going to the far right of that. You'll see a microphone icon. If it is red with a slash through it, you are muted. If it's gray, you are unmuted. So I encourage you to, in the meantime, use the chat function, which Jill Riley has already done. She's paying me money for the compliments I gave to OJJDP earlier. And Katie to let us know that she's on. So you can use the chat box for questions, comments. I, as the housekeeper today, will be monitoring the chat box, and we'll break in with Erin and Wilson Kenney to let them know when we have comments and questions. I'll be spurring you through the chat box to participate, to share your comments. We want to be helpful for everyone, and so that means you participating in any way you can. So with that, I'm going to pass this over to Erin Taylor, who I will unmute and floor.
Jimmy, so everyone is here with us today. I am filling in for Jane Slofsky, who typically runs these. She is another conference and is very sad. I know that she is not able to be with us today. She may join us at some point, but I am just filling in her much larger shoes. So we're really glad to have Dr. Wilson Kenney with us here today, as Jimmy said, to talk about schools and how to address problematic sexual behavior in children in schools. So I'll give a little background on him and then turn it over. So Dr. Kenney received his doctorate in clinical psychology from the University of Utah in 2007. Experience in multiple treatment settings, including working as a school psychologist, and he served as clinical director for a residential outpatient and proctor care treatment facility for adults and adolescents with concerning sexual behavior in Salem, Oregon, prior to making the decision to focus solely on forensic assessment. In 2009, Dr. Kenney worked with the Salem-Keizer School District, who are national leaders in school-based violent threat assessment for students, to develop a school-based threat response model to identify and provide supervision planning for children with concerning sexual behavior. That model is known as the Sexual Incident Response System and is described in Dr. Kenney's book, Sexual Misconduct in Children, and currently utilized in several districts across Oregon. Our areas of specialization include personality disorder, sexual misconduct, threat assessment, and forensic assessment. He started as a forensic evaluator and previously served on the review panel for forensic evaluators. We're really glad that he could be here to talk with us about schools. I know that's a big area of focus for many of us right now, and I'm going to turn it over to him.
I really appreciate that. I also wanted to say I really enjoyed the article that you wrote, that Jane sent me, about Title IX and just sort of the difficulties of addressing that from a sexual misconduct perspective. So thank you for the introduction. I appreciate it.
Thank you. Oh, sorry. Dr. Paul Schaller is on the line, and he and I co-wrote that together. So
great.
So thank you.
Fantastic. Yeah, you bet. So I should give everyone a few caveats before we get started. My 5-year-old daughter is sick today and is with me. I think I have her occupied, but as any of you with kids know, you never can be quite certain. So I might hop off for a second and get her refocused, but I think she's busy for the time being. So just to let everyone know that. So the presentation that I'm going to be taking everyone through today, it's really designed to sort of hit broadly across a number of different kinds of people from multidisciplinary positions. So it is going to seem probably very basic to all of you because I know you all have a lot of knowledge about this already. It's really kind of, this is the sort of presentation that to take out to school districts and give them an opportunity to have a good understanding about the things that are available and what can be done to help kids with concerning sexual behavior in schools. So as getting started here, I think. Obviously, you guys are a seasoned crowd, but we are going to be talking about sexual misconduct and sexual assault and sexual trauma. Those things can certainly be upsetting for a variety of reasons. So obviously, I just want to let everyone know those are the topics we're going to be talking about today. So, as we're getting started, I thought it's helpful to have kind of a story to hold in mind, focus the discussion. So this is kind of a common scenario you might encounter in schools. Time you've talked to Jamie about touching peers inappropriately at school, you've tried listening, you've tried discipline, nothing seems to be working. Jamie's really struggling with making friends and new parents are starting to complain. What can you do? This is really kind of sort of common situation that we have in schools where you've got a situation where a kid is presenting with some kind of concerning sexual behavior and schools are confused about how to respond, right? On the one hand, we have a mandate through faith that we have to educate every child that's in that school. And on the other hand, we've got to have some kind of mechanism to deal with kids who are presenting with concerning sexual behavior. One, ensure that they're getting the adequate supervision so they're not going to be engaging in harmful behavior towards others. But also, too, we really want to protect their reputations. We want a system where the supervision that we have is going to be subtle and hopefully unrecognizable to people who aren't aware of the child-specific needs because we don't want them to be inappropriately labeled in some way that could be potentially hurtful to them. So, why is it important for educators to know about problematic sexual behavior? Well, for some of the reasons I mentioned, right? When you've got a kid who's struggling with concerning sexual behavior or problematic sexual behavior, which is what that little PSB stands for, we care liability. So one of the things I always talk to school districts about when I'm training them to this model is that if you have knowledge of some kind of concerning behavior, whether it's violent threat or sexual threat, you have a responsibility to respond to that information. To do nothing is irresponsible. So the call for a model like this is to make sure that we're addressing liability. But also, too, you know, this is a model that helps kids. It helps identify kids with problematic sexual behavior very early on so that they can get the help they need before that behavior becomes more concerning and possibly more damaging to the community, but also provides a good support system for that kid that's not going to necessarily reveal who they are to others, and it's going to help them be able to protect their reputation. The violent threat assessment model, which I don't know how familiar you are with that as a group. I'm happy to answer questions about that as well. But these models, the violent threat assessment model and sexual misconduct threat assessment model, are really based upon this notion that capturing leakage is the mechanism through which we can best respond to and address threat. So in order for that to work in a school district or any system, there's a couple things that need to occur. We need to make sure that everybody within that system knows what to look for, so they have to have at least some brief training on what is concerning sexual behavior and how do we identify it, and then they need to know who to inform. So although it kind of varies across different sorts of districts or systems depending upon how they're organized, in most districts where I work, usually that information is funneled to the school counselor. The school counselors generally kind of have their pulse on what's going on in the school, and so when we're doing these trainings in school districts, we do a brief presentation that goes out to everyone in that district, and when I mean everyone, I mean everybody, from the folks who are handling the transportation for the kids to folks who are doing janitorial services. It's something that everybody who's in that system needs to be aware of what to look for. And then they all need to know that when we see something concerning, this is the person that you're going to talk to. But there's a variety of things that might be concerning, right? So unusual bathroom behavior, That's something that commonly shows up in elementary schools, where you might have a kid who's ducking under the stalls to try and look at what other folks are doing. A kid who's exhibiting persistent curiosity about sex, especially when you're seeing that among your prepubescent group. If you've got kids who maybe are making sexual sounds in school, or they're making a lot of sexual innuendos or sexual jokes, that might be a kid who's having some difficulty with their sexual behavior. Voyeurism, I'm sure that's probably a term that you guys are all familiar with, but for those of you who aren't, it just refers to rubbing your genitals against someone for sexual gratification. You see this a lot of times in kindergartners and first graders. They often come to school where they haven't been particularly well socialized and rub against the desk or a teacher's leg or something along that lines, for the purpose of getting some kind of sexual arousal. Obviously, when you see that in older students, that can be particularly concerning, because it really speaks to the level at which they're struggling with getting their needs met appropriately. Other students who are engaging in touching other students sexually, kids who are engaging in mature sexual talk, kids who are engaging in grooming behavior, which, again, I'm sure as an audience you guys are familiar with what I mean by that, but when I talk about it, I talk about grooming behavior. It looks a lot like dating behavior. So it's any kind of behavior that a child may be engaging in to try to start some kind of romantic or sexual relationship with other children. Sometimes it can involve gift giving or touching or being in a person's space, can involve sharing notes and things of that order. Sexually aggressive behavior is something I think we know when we see it. Kids who are engaging in sexual threats. Sometimes in schools, what you'll see a lot of is kids who be sending notes to other kids. Hey, I'm going to rape you after school, or if you don't do this, I'm going to assault you in some way. A lot of that now we're also seeing, via texting and sexting, where kids are using that as a mechanism to try to threaten one another into engaging in sexual behavior. There's also lots of other kinds of sexual behaviors that are concerning in the school district, public masturbation being one, exposing self to others. These aren't contact offenses, obviously, but they're behavior that can really disrupt school activity. But this one on that list is really the one that, in my mind, is most important. So any concerning sexual behavior that continues in spite of intervention is something that needs to be addressed. Think about kids. Most kids don't really love being spoken to about their sexual behavior, and oftentimes all it takes is a single conversation to try to convince a child to stop engaging in that behavior. But for kids, that does not seem to be impactful. Obviously, that's an indicator that there's something else that might be motivating that behavior. And when that occurs, the system that I'm going to talk to you about today is a great mechanism for addressing that. So the things that I talk to students or to teachers about and educators about when I'm going through this is the importance of considering age and development when you're looking at concerning sexual behavior. So, for example, here's a list of different kinds of sexual behaviors that you might run into on a school campus. The seriousness of these behaviors, though, really varies as a function of the age of the student. So, for example, if we're thinking about a first grader engaging in these different kinds of behaviors, right? A first grader exposing their genitals at school, obviously it's not something we want to encourage, but that's not considered a completely wild or unusual kind of behavior to be occurring. Oftentimes it can just be an issue that has to do with socialization for that student. But as we go down this list, you can see you'd become increasingly more concerned if you had a first grader engaging in these other kinds of behaviors, right? If you had a first grader engaging in penetrative sexual contact, that would be particularly concerning, and something I think we can all collectively agree would be time for everyone to freak out, right? This is a kid who's got some serious concerning behaviors. But you'll notice it totally changes if we look at those same behaviors in, say, a sophomore in high school, right? Let's look at one that would have been most severe for that first grader, penetrative sexual contact, right? Although we're certainly not encouraging our sophomores and juniors in high school to engage in penetrative sexual contact, we realize that's not developmentally non-normative. It's certainly a normative kind of a thing for kids that age to be interested in that, engaging in that behavior, and provided it's, a consensual behavior that's occurring between, two peers who are interested in that. That's not really problematic. But think about, if you had a student that age who was exposing his genitals at school, that would be particularly concerning and alarming, because it's considered to be developmentally non-normative kind of behavior for a kid that age. So important to keep that in mind when you're looking at the seriousness of the behaviors and trying to gauge how concerning it is, that age and development play a big role. Another that's really important to consider is the relationship between the individuals. So are these individuals peers? One of the things that we've run into in Oregon, and I'm not sure what the laws are in your various states, but in Oregon, you know, if students are within 3 years difference with regard to age, they're considered to be able to consent to sexual behavior. The laws that we have don't consider someone's cognitive ability or their cognitive age. And so one of the things that we ran into with some frequency in Salem is you might have adolescent male who's acting in a predatory fashion towards some of the developmentally delayed females in a program, and the law can't really respond to it because these are kids who the law considers to be capable of consenting to these kinds of behaviors. But as a school district, we can recognize that that's problematic, and we can use this system I'm going to talk to you about as a mechanism to get in the way of that kind of behavior and address it. Any questions so far?
Please, Fox, I will unmute people super quick. Have any questions? So far, this is so aligned with the work that people are doing across the country, and it's great to hear you talk about how this applies in schools. All right, so any questions before I remute? All right, I'm officially remuting everyone.
All right, thank you. Okay, so some important things to generally keep in mind that I encourage people to keep in mind as they're going through this process. It's really unusual for prepubescent kids to have knowledge about or interest in adult sexual behavior. You know, you think about most kids pre-puberty, you know, penises and vaginas are pretty gross. They're things you pee out of. You know, you don't want to touch them. You don't want to have other people touching yours. So when you see a kid prepubescent and they have some pervasive interest in touching them sexually or being touched sexually, it's telling you that something has gone wrong for that individual. Now, an important thing to recall is that does not necessarily indicate that that person has been victimized, right? But it does suggest that they've likely been exposed to something struggling with. And what they've been exposed to really could vary, right? Could be a situation where what they've been exposed to is maybe some brother has shown them some pornography, or maybe their dad has a new girlfriend, and the child can hear the parents engaging in sex, and that's kind of upsetting to him. Or, you know, it could be that there's a peer that maybe has been a victim, and now that individual is starting to want to play more and more sexual games with them. It's always important, I think, to keep in mind that just because a kid might be exhibiting concerning sexual behavior doesn't necessarily mean that they've been sexually victimized, but it does suggest that something's going on. Now, I have it on the slide. It's something I stole from my wife. She's a marriage and family therapist, but every behavior makes sense given its context, right? And we should always keep that in mind. We know behavior is communicative. We don't have any question about that anymore. So when you're seeing a problematic sexual behavior, part of the purpose of a system like this is it's really to give you a mechanism to be curious about what's going on for that individual. So what this threat assessment system looks like. So just a reminder, we kind of mentioned this at the beginning, but this was a system that was really designed to go along with a pre-existing threat assessment system that was already in place in Salem-Keizer School District. Probably most of you know, Salem-Keizer has really led the nation in terms of developing a good threat assessment model for identifying kids with concerning violent behavior. And it was through my relationship with John Van Driel, the guy who developed that we kind of came up with the idea that it would be nice to have a health system that looked specifically at concerning sexual behavior. So when I was hired on at Salem, that was my job, was to really go and create this system that looked a lot like the threat assessment system for violence and that could be easily implemented. So it was nice for me in the sense that I had a pre-existing framework upon it could really develop all these things. But the way that the system is designed, it's really designed to go along with that and be in partnership with that violence threat assessment system. So just a little visual for how it works. School learns of a threat. What it's important to realize is it doesn't matter whether or not that threat is occurring on campus or off of campus, right? But as mentioned before, as soon as a school has knowledge of some kind of concerning or threatening behavior, they also have the responsibility to respond. They've got the liability of carrying that information. This has been something that can sometimes be challenging for school districts to get, because I think oftentimes they've got this idea of like, hey, if there's a kegger on the weekend that's going on and we find out about it, we don't feel like we should be necessarily involved in the disciplinary action for that. But it's important to realize that when it comes to threat, it's a lot different. So when I do trainings about this, I talk to people about it's really easy to think about this in terms of violent threat, right? If a school district found out that a student was building a bomb off of campus, I wouldn't treat that as like, well, that's happening off campus. That's really none of our business. We're not going to pay attention to that, right? That's very relevant in terms of threat, because there's a good likelihood that the student who's building that bomb could bring it onto campus, and then it would become a very real problem, right? So they have to respond to it. And the way that I talk to school districts about it is with sexual misconduct. If you've got a kid in a community who's struggling with their sexual behavior, that is a potential bomb that could go off in your school, and you need to address it as soon as you have knowledge about it. So it doesn't matter where that information about the threat comes from. Once that information is identified, the school has to respond. So when in a school district, the school resource officer, the administrator, and the counselor determine whether or not there is a need for a level 1. So the three of them will get together and have a conversation. In a lot of school districts, the availability of the SRO really varies as a function of the school. So SROs tend to spend most of their time in middle schools and high schools and less time in elementary schools. So what that means is that's going to be a phone call rather than a face-to-face meeting. But as soon as the district learns that information, three folks need to sit down and have some conversation about how they're going to address it. Now, when they look at it, that's concern. And if that happens, then they go through and they dismiss the case. They document what they have done. They provide discipline if discipline is needed. They might communicate with the relevant parties, and then they would do whatever administrative action they need to do. However, they might feel that there's a concern there. And if there's a concern, they can activate what's known as a level 1 team meeting. At this level 1 team, you're going to have all the important folks who are part of that kid's life. The administrator is going to be there. The school counselor is going to be there. SRO, you're going to invite the parents, and you invite other relevant parties that might have important information to share. So, for example, if that student is involved in special education, you're also going to invite their case manager. If they're involved in foster care, you might want to invite their DHS case manager. Whatever relevant parties would have important information to share, you want to make sure they have an invite. But that meeting occurs the same day the school learns of the threat. At that meeting, they go through a level 1 protocol, and in that level 1 protocol, it's got a number of different questions. We'll talk about what some of those questions are in a minute, that help them make a decision about the seriousness of that behavior, and then develop a supervision plan based upon the concerns that they find. If they go through that and they find that there's no concern, then go to what you'd normally do. They would dismiss, they document, discipline, communicate, and administrate. Sometimes level 1 teams go through that protocol and they find that they're able to develop all the things that they need for a supervision plan without seeking any additional consultation. Maybe it's a relatively simple problem, or would like to at least attempt an intervention on their own initially. And so sometimes, for most situations, it's not really going to go beyond that level 1 team. However, in cases level 1s, as that level 1 team completes that level 1 process, they realize we need additional consultation. This is a very challenging case, and we're going to need to bring in the big guns. We are aware of those additional consultation needs. They to a multi-agency level 2 team. This team meets on a weekly basis, and their job is to provide consultation to the level 1 teams. The folks in this team are really folks from all around the community. So you've got folks there from mental health, you've got folks there from the DA's office, you've got folks there from the school district, you've got folks who work with kids with concerning sexual behavior. They're all at this meeting. And they're able to be there is through a memorandum of understanding that allows them to have this space in which they can discuss these cases without concern about that information getting outside of those meetings in a way that would impact HIPAA or FERPA, depending upon the organization. So that level 2 team meeting, they go through and they look at the case from the level 1 team. If someone from the level 1 team comes and presents it, they have a discussion, and that level team then provides consultation back to the level 1 team at that meeting in terms of recommendations. Here's what we think needs to be done with supervision, and maybe here are some community resources that we can activate immediately to help you with that process. Also deals with move-ins to the district. So sometimes you've got kids who may be identified as having problematic behaviors through juvenile justice, so they've gotten arrested for something over the weekend or over the summer. You realize that the thing they've arrested for is sexually concerning. So that level, when that happens in the districts here in Oregon, information is sent directly to the level 2 team, and that level 2 team goes and provides consultation back to the school in terms of recommendations about supervision, so that the minute that kid gets attention and gets into the school system, they've already got a pre-existing supervision plan in place. Sometimes you've got kids from foster care who may be moving into the district where they have pre-identified concerning sexual behavior. When that occurs in the districts here in Oregon, that information goes directly to that level 2 team, and again, they help develop a supervision plan before that kid puts their feet on the ground. Kind of helps the magic happen in all of this is that level 2 facilitator. And that level 2 facilitator, their job is to make sure that the information that's being passed back and forth between the level 1 and the level 2 teams is occurring. They also track any of the cases that are on the level 2 and need to be reviewed, for those reviewed periodically. And they also really help to orchestrate that level 2 team and make sure that all the different partners in that community are having an opportunity to talk and communicate about what would be best for that kid. So a little bit about who to inform, right? If you want your folks to sure we're capturing all this information, you got to know who to talk to, and when that school administrator and school counselor and resource officer make a decision about whether they're going to have a level 1 meeting. Here's some of the criteria on the right-hand side you can see to kind of list some of the things that they may think about. So level 1 meeting occurs that same day if there's a sexual threat made at school, if the physical evidence that's been discovered on campus, if the school staff learn that there's some sort of problematic sexual behavior occurring at the school or in the community, if that problematic sexual behavior is causing disruption at school, if there's a history of problematic sexual behavior, or if staff, students, parents are concerned about problematic sexual behavior, or if the administrator cannot assert that problematic sexual behavior is unfounded. Those are things that would move it to a level 1. That level 1 meeting, again, here are the people that you might see there, the administrator, the counselor, the SRO. Parents are invited to participate, and we also have an interview material that goes along in the event that a parent can't participate or won't participate. One of the questions we commonly asked is, what happens if we've got a parent who refuses to attend and they don't want to be a part of the meeting? And the important thing to remember is that ultimately, although this model does a lot of really wonderful things for helping kids with concerning sexual behavior, ultimately it's really meant to control liabilities for schools. In terms of whether or not a parent participates, that meeting needs to be held that same day. Think about any threatening behavior that is causing the school day to stop so all these people can have a discussion is serious. It needs to be addressed immediately, and it's not something that parents can put the brakes on just because they're uncomfortable with the process. There might be other relevant parties there I've mentioned before, and at that level 1 meeting, they go through the level 1 protocol. They decide upon this position whether they're going to dismiss or generate a supervision plan or take it to a level 2 team. So in the level 1 protocol, so the first thing in the level 1 protocol, and I'd be happy to share what level 1 protocol looks like with everyone meeting. I can send you a copy of one if you'd like. But it starts out with a disclaimer, and the focus of the disclaimer reminds everyone this is not threat assessment in the sense that we're trying to identify threat for this individual. What we're looking at is the situation. It talks about that it's not the role of this process to identify who the perpetrator and the victim is, but really make sure that we're gathering enough information so that we can put a good supervision plan in place, talk about the limits of this kind of a process, and that, the things that influence threat can change very quickly, and so just encourages people to be thoughtful about the passage of time and the fact that other things can influence that process. And then a number of screening questions, and in these screening questions, just very simple, straightforward questions that ask about things like balance of power, whether or not there seemed to be an element of coercion that was involved in this contact, whether this is an isolated event or there's a pattern of this kind of behavior, or not it seemed impulsive or planful, whether or not this appears to be normative, and you're able to figure that out. If it was confusing or uncomfortable for any of the participants involved in this interaction, any evidence of grooming, and then was there any pornography or sexting that was uncovered in this process. And upon those questions, and I think there's about 14 of them altogether, the team then makes the decision about, are we able to put a supervision plan in place that will meet the needs of the student immediately, or do we need additional consultation from that level 2 team? So something about in this process, obviously threat is concerning, right? So stakes are high. The things that we have that are competing is that child needs to return to school as soon as possible with their reputation intact. One of the things we know about kids with concerning behavior, whether it's concerning sexual behavior or concerning violent behavior, is we're going to do as much as we can to help encourage routine and to put them in an environment they're going to have supervision. And ultimately, there's no better environment for that than school. So the idea of, expelling a kid or suspending a kid because of these kinds of behaviors really go against your own self-interest as a school district, because you might be creating a situation that's actually going to amplify threat rather than diminish it. So you want to get that student back to school as quickly as possible, and you want to make sure that you protected their reputation. The school, on the other hand, they need a viable supervision plan before that student returns. So you want these things to happen quickly. Level 1, again, occurs the same day the leakage is captured. Parents are encouraged to participate, but not necessary. Another important thing to think about is this process is not disciplinary. This can sometimes be a sticking point for schools, right? Because they have their own disciplinary functions, and they want to feel that a child has been sufficiently punished for traumatic behavior and not just put a supervision plan in place. But for those of you who work with kids with concerning sexual behavior, I think we probably all recognize that a lot of these kids, they're really struggling with this behavior. They're not happy about it. This is not necessarily some kind of behavior that they're engaging in that they want to be engaging in, but they're troubled by their problematic sexual behavior. So we really try to encourage schools to think about this as a separate function. The purpose of a system like CIRC, provide supervision for schools, it's not meant to be punitive. It's not meant to be disciplinary. And it's not meant to be hurtful to the kid. It's really meant to be helpful. With problematic sexual behavior, obviously, they need support, routine, and supervision, all of which schools provide much better than just sending a kid home or expelling a kid. And we know that isolation and suspension can really exacerbate a problem for a kid with concerning sexual behavior. The way I think about it, again, because a lot of this mentality comes out like violent threat, if you've got a kid who's coming to school and they're threatening to shoot up the school, the last thing that they need is time on their own to develop a better plan, right? They don't need to send home where they can really work and put time to that bomb that they're building or make sure that they're gathering up their weapons. What they really need is they need an opportunity to be around adults who care about them and are going to be paying close attention to them. The same thing with concerning sexual behavior. If a kid is struggling with concerning sexual behavior, they don't need more time on their own isolating away from their peers. What they need is more time being well supervised. 2 happens if the situation's intense, or if we've got a situation where it's very clear that that problematic behavior is not normative. So as folks are going through that level 1 process, they might decide that they're going to request a level 2. If they feel like they've got concerns about supervision, even after they've gone through that level 1 protocol, or if they need some kind of additional support. That level 2 team, again, it's a multi-agency approach. You've got school district staff there. You've got folks from law enforcement and criminal justice, community mental health, Authority, and Department of Human Services. And there may be other people you want to include depending upon how your community functions. But the idea is anyone who's involved in the life of that kid should be at that meeting. Again, it's all takes place through a memorandum of understanding, and I've got copies of what that looks like if you guys would like to see those materials. I'm happy to share them. So in the meeting, someone from that level 1 team comes and shepherds that information. They come and they present the case. So someone who has firsthand knowledge about the concerning behavior, usually it's a school counselor or school administrator. They come to the meeting and they talk specifically about what their needs are. In that, after they present, that level 2 team muscles together and they come up with some interventions and resources that they can put in place to be helpful to that kid. They make recommendations to that level 1 team, and then that person from the level 1 team takes that information back to the school. Now, that the level 2 team is purely a consultation body. So the administrator of the school where that level 1 occurred, they're really under no obligation to follow that information. However, obviously it's a team of multidisciplinary professionals in the field, so more often than not, school administrators are very motivated to look at that information. And then once case is presented, that level 2 team decides how often are we going to review this case, and that level 2 facilitator will go and check in with that level 1 team on whatever that team decides. So it could be on a monthly basis, could be every 3 months or 6 months, depending upon the severity of the case, so that making sure that we're not losing the fidelity of that supervision plan over the course of time. That's how we make sure that it's continuing. That level 2 facilitator is going to check in periodically to make sure that system is still in place and that it's being helpful to that kid. So part of that level 2 team meeting is then reviewing old cases, kids that have been identified, and making sure that they're getting the support that they need. Some consultation about supervision and intervention sometimes involves referrals. So it may be that through the course of that discussion with that level 2 team, they say, hey, this is a kid who might benefit from mental health services, or maybe there should be a referral to DHS, or maybe juvenile justice needs to get involved. It's also a mechanism to kind of activate community resources and get additional funding and resources for that kid. And that level 2 team then continues to track that information until the level 1 team says that the case is resolved. Level 2 process, assign and manage the liability. So one of the lovely things that comes out of this level 1 and level 2 team is everybody is clearly assigned what their pieces are in terms of helping to maintain a good supervision plan for that kid. So as they go through that process, it's clear the school has a role, it's clear that people in the community have a role, but also the role of parents is articulated in that process as well, so that everybody knows here are the things that we need to do in order to make sure that everybody's safe. So the things that occur in that level 1 and level 2 meeting, sometimes if you've got an identified target, you might have to protect that target. So there's a mechanism through that CERC process. It provides paperwork and kind of the wording in order to go through that, but gives you a mechanism to warn the potential target so that they know about the threat and the family knows about the threat, so that not only are we making sure that liability is covered in the school district, but also in the community. Part of the plan might involve individual options, so an accountability plan for that student. It's going to be other kinds of school-based options that look at like level of supervision, areas of supervision, making sure that you have knowledgeable adult supervisors in situations where kids are going to be more in need of that, and also examining some of the special considerations, like for example, after-school activities, or how are we going to handle technology when a student maybe was accessing pornography at school. So there's a mechanism for that. Also provides a number of different recommendations to the family regarding safety and supervision. So what's the parental responsibility? How can they make sure that they're maintaining line of sight at home, if that's also something that needs to be done? Maybe discouraging parents from having their kid go to sleepovers or putting them in other situations that could be potentially problematic. And then there's also a list of community options on that supervision plan that talk about different mental health resources or faith-based resources or other community organizations that could potentially be helpful. And about that model.
Thanks again. Just quickly unmute people so you have the opportunity to ask questions. This is amazing information. Questions or comments from the audience?
Yes, Jimmy, this is Karen. I do have a question. This is an amazing model, and it's very exciting. One would be, are we able to share this information with our local school districts? And we provide services. We're a child advocacy center. We provide services in 2 counties. So we have 23 school districts within each county. Does each school have their own team, I'm assuming, or one team per county?
Yeah, that's a great question, and it really has kind of varied in the way that it's been set up here in Oregon. So some counties do it differently than districts, but what I found to be most effective is each district has its own level 2 team. So what mean is that all of those schools in that district would then use that same team whenever they have that need for consultation, and then each school is going to have its own level 1 team, but each district should have its own level 2 team.
Thank you. Be able to share information is, I did buy your book, and we're in the process of reading it. I'm just wondering if we can use the information on your PowerPoints in.
For sure. Yeah, you can use all the information on my PowerPoint. Feel free to use it and disseminate it. It would be great if you could just keep my name on there so people know who they can get in touch with if they need to. The book is a great resource, I think, in terms of helping people to figure out how to set it up. But also, too, in Salem Kaiser, the woman who runs the CERC model right now, her name is Shelley Rutledge. She's a wonderful resource. But a couple times a year, they put on a training, a 2 training, where they walk districts through exactly what this looks like from the bottom. You have an opportunity to see a level 1. You have an opportunity to see a level 2. And get all the materials that go along with how this process works. So they're run on a pretty regular basis. I'm happy to share Shelley's information with you guys, and that has really become like a great mechanism for people to go and training about it. Most of the stuff that I do is consultation stuff, which is limited in some ways, right? Because, I'm not in a school district anymore. I don't have my feet on the ground. I try to encourage people to go and access that training through Shelley whenever I get an opportunity. If that doesn't work out, I'm certainly happy to provide consultation on this stuff as well.
Thank you for that question, and Wilson, for being so willing to share resources. I did post in the chat box for those that are looking at a computer screen the link to Dr. Kenney's book, Sexual Misconduct in Children, and we can send out as well later.
There's a lot of other material that I included in this presentation, and much of which I was not necessarily expecting I would have time to get to. I just wanted to make sure that everyone had access to some of the other things that are included in this training. But there's one thing that I think is kind of important that I want to talk to folks about, because it kind of gives a sense for how big this is. This gives you a sense of like what the actual numbers look like in terms of when you're implementing this. So this is all information that's based on the Salem Kaiser model, which is a district of about 40,000 students. It's a pretty big district. They get 120 new level 1s yearly, and there's the breakdown. About 55% are in elementary school, 38 in middle school, 7% in high school. It's kind of surprising. A lot of that problematic sexual behavior, you're catching it really early on. And the nice thing about that is that in some ways this model can become proactive, right? You're getting those kind of prodromal indicators of concerning sexual behavior right as it's kind of budding, so you can address it immediately rather than waiting until it's getting so serious that it's really impacting others in a more profound way. And doing about 60 to 75 new level 2s yearly. And you notice there's a complete flip-flop with the data there, right? So although the majority of level 1s come out of elementary school, very few of those are actually going to a level 2. Look at the ones that are being identified at middle school and high school, the overwhelming majority of those, right, are going to be headed to level 2 teams. And that should kind of make sense, right? When you're looking at kids who are in middle school and high school, the potential ways in which they can harm others sexually becomes much more serious. And so more often than not, they're going to need some kind of level 2 access in order to help them through that process. The other thing that's important to note about this is that 6% of the cases that are identified are special education cases. And I've got a couple of things about why that might be the case. I think part of it is obviously we know kids who are special education kids, these are kids that are much more likely to be victimized. So it may be that what we're seeing is a reflection of that. But I think the other thing that goes on for special education kids is these are already getting a great deal more scrutiny than kids in general education. And so I think we're able to identify concern behavior a lot faster and earlier than we are necessarily in our general ed population. So I thought that might be helpful to give folks kind of a sense of what it looks like when you're implementing this kind of a process into a pretty large metropolitan area. Also to let you know, I'm working on a second edition of the book, and in that book we're going to be talking specifically about how to do this work in rural areas. My wife is a special education administrator in Frisk Grove, which is a really small little district, and she runs the CERC and STAT programs in that district And the way that they implement it there, it's a little bit different because they don't have nearly the resources, but they also don't necessarily need to meet as frequently. So we'll be talking more about that. But certainly for those of you who might be functioning in smaller areas or smaller districts, I can help you find resources that could provide you useful information about how to implement this kind of an approach in those environments as well.
That is, it is really exciting to hear the work they have done and how it really is widely applicable across the United States and probably even on the United States. I'd like to open it up. We have about 10 minutes left, and such an amazing presenter and wealth of knowledge and experience available through Dr. Kenney is amazing, and I want people to have at that. So I'm going to, again, quickly unmute and open it up. What questions, comments do you have for Kenney?
Hey, Dr. Kenney, this is Paul Schaller here in Oklahoma, and I had a question which I typed in also to the chat box, but many of us work outside the school system, and I think your messaging to kind of garner attention around this particular topic is definitely important. How would you recommend outsiders approach school systems to get them to adopt a system such as the one that you've talked about today? Any pointers or words of advice?
That's a great question. As you probably know, right, school districts are just incredibly overwhelmed. They've got more work than ever before, and they have less funding than ever before in order to accomplish it. So one of the things that I talk to school districts about when I talk to them about the model is that they're already dealing with kids with concerning sexual behavior in their schools, right? And the problem is that they're not dealing with them in a way that that is systematic. And if you look in the newspaper on any given day, you will see some school district that's in the process of getting sued because they didn't handle a kid with concerning sexual behavior in a way that really was efficacious, right? And so what I try to encourage them to do is like, hey, all this is doing is formalizing the way in which you address kids with concerned sexual behavior. It's not requiring really any more work to do, and what this will do is this will allow you to be able to identify those kids early on and make sure they're getting the services they need. I found that encouraging parents to back this can also be a really strong message to schools. I think most parents are concerned about sexual misconduct and letting them know that, hey, there's a system in place and it can, help motivate your school to get involved in this kind of a process. This can really help make schools and communities a great deal safer because now you've got kind of a mechanism for dealing with it and everybody's looking at it in the same way.
Just one quick follow-up. Is there any hesitancy of schools to recommend treatment? Because if they recommend it, would that mean that they would have to have funding streams tied to that recommendation?
Smart question again. So when we go through this process, we don't make recommendations regarding treatment or not, but we let parents become aware of, here are the resources that are available to you, right? Here are the things you can go and pursue if you feel inclined to do so. If it's a situation where a kid is presenting with problematic sexual behavior that's illegal, they're probably going to have to do treatment whether they want to or not, and that's going to come through juvenile justice, not through the school district, right? If it's a criminal issue where not necessarily a situation that juvenile justice is going to get involved in, we let parents know, here are the available resources, here are the things that could be potentially helpful to you. And if you'd like to avail yourself of those, we're strongly encouraging it, but we're not by any means recommending it or mandating it. I think about it, I think the position that makes the most sense for schools is that, hey, our job is to make sure kids are safe at school, right? We don't provide treatment. We have a mechanism to do that, and we can't recommend treatment because then we'd be on the hook to pay for those kinds of things. We'll continue to keep this plan in place for your student to make sure that they're safe and the students around them are safe. And we really aren't going to change that plan unless we know that something has changed significantly with regard to them. So if you want to get them off supervision at some point, treatment is probably an effective way to do that. So you're leaving it up to the family. One of the things, this is kind of an interesting aside, but that's happened down in Salem-Keizer School District. DA there is particularly involved in the CERC process, and he really likes it. What we started to do is when a school district identifies a kid with continuing sexual behavior and makes recommendations to parents, if those parents don't follow those recommendations, the DA will then get involved and start to put pressure on the parents so that the school district doesn't have to do it. But the DA is essentially saying to the parents, hey, if you can't implement these things that we know are going to make the community safer, then we're going to look at the possibility of getting DHS involved to put pressure on you. And that oftentimes can be a really wonderful mechanism for encouraging parents to get involved in treatment. But all of that heat and pressure coming mostly through juvenile justice in the DA's office and DHS, but not through the school.
That was super, super helpful information. Thank you.
Question, Paul. We have really just about 2 or 3 minutes left, and I want to ensure that everyone has access to Dr. Kenney while we have him. What other questions, comments, do you have for a presenter?
Dr. This is Erin from Oklahoma. I appreciate the information you've shared, and I was wondering, kind of in line with what Paul had asked, a lot of our teams are doing a lot of community outreach, and I'm just wondering about in the times when maybe you've consulted with other schools, what are some common barriers that you are hearing from schools? We've talked through some of them, but that they could kind of come armed with some data to try to address with schools in terms of addressing these behaviors in their settings.
It's funny. I've not really experienced a lot of pushback in the schools here in Oregon. I'm generally being called because they want this system specifically and they want to know how to implement it in their district. So the districts around Salem are excited about this and wanting to implement it. I really can't think of, I think we probably got this in like 60 or 70% of the districts here in Oregon right now. So we have not really experienced a lot of pushback with regard to schools, other than the fact that, oftentimes there can be funding issues, right? The one thing that a school might be facing in terms of funding is trying to find a person to act as that level 2 facilitator, right? And depending upon the size of the district, that might be one individual or that shared position that a couple of individuals share, depending on how large the district is. But I've really not experienced a lot of pushback from schools. They mostly seem to be interested in a system in place that's going to, enable them to all be dealing with sexual misconduct in a very similar way, and they see the need for controlling the liability and potential benefit to the students. So I've not really had a lot of pushback. What kind of pushback are you guys getting?
I think that's really interesting. I think, here in Oklahoma, what we sometimes hear is just schools, it's not structured at all in the first place, so just not really knowing what to do, and so kind of wanting to stay hands-off in some ways. But also, I think, not having had this, sort of not knowing the benefit of what it could be.
Right.
Of thinking through that, and just that comfort with sexual topics, sort of being like, no, we don't want to talk about that.
Right.
In the school setting. Although I think you just made a really nice point about, like, they have to deal with them. They're in their schools every day. So.
And I think there's a lot of ignorance. People want to stick their head in the sand, right? It's no one likes sexual misconduct. No one wants to talk about it, that kind of thing. Not to plug the book, but when I wrote the book, I rewrote it thinking about the administrator that I felt the least amount of faith in the district I was working. I wrote the book to him, thinking about, like, the person that I feel is kind of most incompetent. I want to write a book that this person could pick up and read and feel like they understood it and feel excited about it. And so it's meant to soften all of that and to be kind of a soft entry point for administrators into better understanding the importance of sexual misconduct. And for those of you who may have looked at it, it's a lot of stories and things in there. It's meant to be baby food. I really tried to make it just yummy and edible everyone would enjoy it. He even has a chapter in there about how weird it is to deal with sexual language. So I think there's a lot of good resources in that book that can help you sell this approach to districts. And it does really kind of take a soft entry into the world of sexual misconduct. It's not overly heady. If you've looked at it, there's no research in it. You know, it's just meant to be kind of a very friendly examination about how to look at sexual misconduct in schools. So there may be things in there that can also kind of help you sell it and get schools excited about it.
Thanks for sharing that. I know that we are at time. Sorry, Jimmy, I think you were going to jump in.
I was going to say just that Karen Hill did have a quick question. I'll put it out there. If you can stay for the extra minute or two, wonderful.
Time. I can stay. Yeah, I can stay.
Excellent. If others on the call need to exit, that's okay too. A really quick question, and then we'll end the call for today. Karen Hill, again in Olean, New York, asks, how does this process work with mandated reporting requirements?
So first, shout out to Olean. My family actually came from House and kind of some areas around Olean, so I've been there repeatedly. But yeah, so great question. How does it deal with mandatory reporting? So that process just continues as it normally would. So when you've got information that you think would suggest that a kid may be victimized, you contact DHS and law enforcement and you let them know. Here in Oregon, DHS and law enforcement have really good cross-reporting process, so you really only need to contact one or the other. I don't know what it's like in your particular area, but you do the thing you'd always do. So as you identify there's a concern, you let DHS or law enforcement know, but you continue with the CERC process, right? Because the CERC process, still you really need to be able to make sure that that student has a nice way to school the next day that's safe, and so you still would take them through the level one, so it doesn't really change anything.
For that response, Karen responds, awesome. Donnie, we have really enjoyed having you on our Journal Club today. I'm really happy that we've had such great representation of sites from across the country, and of course, our friends and colleagues, the Office of Juvenile Justice and Delinquency Prevention. We'll reach out, Dr. Kenney, to you to see if we can get a copy of your PowerPoint. Several people have asked about that, and also to follow up on the other resources you offered to share. Please remember on this call that we've sent the link out for Dr. Kenney's book, Sexual Misconduct in Schools, and also the chat box. If you're an ATSEM member, you can access the article that Aaron, Paul, and Jane wrote around Title IX and children with problematic sexual behavior. Thank you, Dr. Kenney, very much for everything today, and we look forward to a continued relationship with you and sites benefiting from your expertise and knowledge.
Well, my pleasure. I've really enjoyed talking to everyone. And, you know, if people have questions or need more information, just feel free to email me. I'm more than happy to do whatever I can to help you get the information you need.
Well, thank you very much. And have a great weekend. If you're somewhere in the winter weather, we hope that you stay warm and safe. Otherwise, enjoy the weekend and look forward to the next Journal Club, which is today. And we'll see you then. Goodbye, everyone.
Bye-bye.